Good morning. My name's Cammie Hansen. I'm a member of the Pleasant Hill Commission on Aging. Also a member here today is Marion Grizzy in the back there. Our speaker, Mike, is a former commissioner on the Commission on Aging, which is an appointed position in the county, appointed volunteer commissioner. Today's workshop is sponsored by our commission, and I'm appreciative of Mike for coming back to do this for us. Today, we're a hybrid of in-person and on Zoom. Marion, I assume people can ask questions on Zoom today? Okay, so if you have an audio only for questions on Zoom today, the event is being recorded and put on the city's website. So if you want to see it again and again and again, you're welcome to do so. Restrooms are located for those present in the side door over here. There are index cards in the back. If anyone has a question, they don't want to speak out loud and they want to make sure it gets heard, if you hold it up, I'll pick it up from you, okay? Okay, Mike, it's all yours.
Thank you. I don't need that one here. I'm Mike McDonald, and I am a financial planner here in Pleasant Hill. I've been doing this since '79. My practice has been in Pleasant Hill since 2002. I'm in the terraced building at 2300 Contra Costa. I'm a fiduciary. I'm a registered investment advisor, and I'm an accredited investment fiduciary. I don't work for any insurance companies. I can't even sell you the product. So I do it as an advisory level to my clients. And so I think we'll have kind of a relaxed time here and answer questions. And we'll cover some Medicare. And if we have time, we'll cover a little bit on long-term care at the end. And anyway, and you can interrupt me. It's okay. We've done these many times. And so a quick question. How many of you, if you could show me in your hands, are currently on Medicare? Oh, good. Usually a lot of these, you have people who are on Medicare, and that's a whole different little presentation. So those of you that are engaging at age 65, just so you know, I am not only an advisor, but I'm mostly 5 years. I just turned 70 on last Saturday. So I've been a consumer of Medicare for 5 years, and I have opinions on that. It's okay to interrupt me. We're going to go through some presentations. This is put together by the city, by the Commission on Aging. And I will tell you, the cool thing about that commission and the city of Pleasant Hill is they really try to disseminate accurate, good information. And they do. I was always touched about the authenticity of what they try to do. So they use the resources here because it's a pretty wonderful community center in the community process. That's my only commercial for the city of Pleasant Hill today. Anyway, and so we'll continue on. A couple key points we try to do in Medicare, because Medicare there's a lot of tremendous amount of disinformation. There's a lot of, when you're trying to acquire Medicare, just of you who are on it, we're coming into open enrollment season in October. So you're here at an appropriate time as well. And if you're new, you're at that when do I sign up conversation, and we'll talk about that. And what are your options? And we're going to talk today about, what is A, what is B, what is C, what is D, and what are our options in terms of that. And I think that I'll answer some questions that I've had, and hopefully at the end of this, you're a little more, the blood pressure's gone down and you're relaxed, and you'll realize it's not the evil empire that you're dealing with. And there's some great online tools for you in terms of, you will enroll in Medicare if you haven't. Otherwise, there's a penalty. That's how you acquire healthcare. And we're going to talk about how, in private insurance that goes with it. So you have Medicare, then you have WRAPs, or you have C, and we'll talk about that and what that means today. And I think that's probably one of the more important conversations, because when you talk about, do I do regular Medicare with a supplement, or do I do Medicare Advantage? A lot of it comes down to your personal economics, because as we age, when we're in our 40s, occasionally we talk about healthcare, and then when we're in our 50s, it becomes more of a conversation. And when you're in 60s, it's pretty much most of the conversation. And when you hit 70s and 80s and 90s, it pretty much is the conversation about healthcare. And Medicare is the one that ties a lot of those together. And so if you're currently working and you're employed and your employer has wonderful healthcare, so what does that mean about Part B? Those are kind of the questions we'll tackle. Because sometimes if you're in a larger firm or a retiree, the supplement is really magnificent in terms of that. And we'll talk about out-of-pocket costs, because that's the big thing in terms of that. And then we're going to talk about, what's going on in terms of running out of money. And we'll dispel some of the rumors about, I think personally, Medicare as a financial planner, we talk about, there's a lot of bad information. Medicare's not running out of money. And I know we like to say that regardless of who's president, this is not a political conversation. That's the third rail, and no politician's going to deal with that in terms of that. And so we'll talk about that a little bit later. So what is Medicare and who needs to enroll and when? So Medicare is a government service that is a healthcare provider that, really was started, when we rolled out, it's a subset of Social Security. And so we're in a situation where when it rolled out, they're trying to figure out what is our national healthcare policy for seniors. Because healthcare, anybody that owns a small business and pays group insurance premiums understands that when you hit age 60, it is prohibitively expensive. Or anybody that's gone out and bought individual health insurance at age 60, 61, 2, 3, 4, 5, it's prohibitively expensive. And so we're in a situation, and what are the costs when you in turn elect to enroll in Medicare? And what happens? I mean, you automatically enroll in A, but what happens about B? You have to jump on that one. Well, what if you have good health care? So those are the questions that people ask. And we have a different group of some people who are not engaged and some that are engaged. And so we'll touch on that a little bit. The other thing we're going to talk about, costs, and those that are on Medicare, we'll talk about IRMA a little bit. Everybody know what IRMA is. That's when you pay your quarterly, your Medicare premium every other month comes out. And if you make too much money, you pay IRMA. And we'll talk a little bit about that. That makes people annoyed because they think about, I was supposed to get a subsidy, and you do have a basic health care, but you also have a penalty if you make too much money, and that phase in. And we'll talk about that. We'll talk about how inflation impacts this. We'll talk about medical inflation, which is different than regular inflation. And we'll talk a little bit about, one of the challenges that comes in why we add a little long-term care, that we'll talk about the increased need for services and expenses as you age. And you go back to those activities of daily living, and you're in a situation where what that means, what does Medicare cover when it comes to long-term care? I'm going to answer that question really quickly. You know what Medicare does not cover? Long-term care. And so everyone thinks it does. And so it's a situation, we'll talk about the 100 days of coverage when it talks about if you're in an acute setting versus, and you have to show signs of anybody that's had a loved one or themselves in a skilled facility, and all of a sudden they're in a situation where they have that Tuesday meeting where they see if you're improving and you're not, all of a sudden you can't stay in the skilled facility anymore, because Social Security for those first 100 days, you have to show recovery. And so we'll talk a little bit about that. But rest assured, Medicare does not cover for that long-term care situation. So when do you enroll? The big question it comes down to. So of those that have not enrolled, is it a situation, are you currently covered under a large group employer? And so in that, there's some advantages to that. So when at 65, you can enroll 90 days before, 90 days after. We'll talk about special enrollment periods and things like that. But at that point is when you all sign up and you get your Medicare card and you get Plan A. And if you're covered under a good group employer, then your B is going to be covered by your employer. It's going to be part of your healthcare. And so then when you retire, so just a quick one. So when you retire, let's say you retire at 67 and not 65. At that point in time, you would be adding your B unless you have retiree healthcare. At that point, you can maybe stay on instead of B. They call it, it has to be, you get a certificate of, it's compatibility. It's the same. And if you're with a major employer, then it's not a problem in terms of that. But so you have healthcare. You also have COBRA. What happens if you're in a situation where you work and you then leave, and now you have this 18 months where you have to make a decision, but you can stay on Part B. You know, there's some flexibility, and we'll talk about that. What if you have individual insurance? I'm going to tell you, if you have individual insurance at age 65, you're going to jump on Plan B because it's going to be significantly less in expense. If you have individual insurance and you're hit 65, that is a really lovely time, because at that point in time, you're going to save some money because your individual health costs is significant. I will tell you that in terms of that. Other would be if you have, anybody have TRICARE in here? Anybody federal employees? So you're going to be the happiest person in the room because it's a really spectacular integration. Just, are you currently on Medicare? Oh, okay. So then, you know, I'm with clients, and I just was one yesterday who's up in near Travis, and she just has this big smile on her face as she's got the new most advanced pacemaker put in, and she just said TRICARE was just spectacular. So, you know, I was going to give them a little thing. So what happens? You're approaching age 65, and so this is when it kicks off. So here's the question. If you're approaching 65, does your Social Security start when you're 65, or just your Medicare? Anybody have an answer? Well, your Social Security, well, unless you took 62, I guess that would be a true statement, which we would arm wrestle you on if you wanted to come down to the office and not take it at 62. But in your Social Security, usually if you haven't started your Social Security, your full retirement age is 67. So you would start Medicare and not start Social Security, because Social Security would start at age 67. And so a couple things, I didn't do a couple things, I just flashed on that. There's a handout in the back that summarizes a lot of what we're covering. There's enough for everybody. There's also, if you're here in present, I like to reward people who are here. There's another little handout on being a caregiver in terms of that. And I think those are just two handouts. If you ask really good questions, I brought some really cool little financial books about, in case you get hit by a bus. They're really lovely books that I give clients. And if you ask a good question, you nodded, so here's one for you if you'd like. And so that was good enough. So it's a good little book. I like it. And doesn't sell anything. If you put your email address on the sign out form, or if you're online and we have it, I will send you the PDF of this handout, and everyone will, if you want that, I will be more than happy to send you. The other thing I do have in terms of, we have some really lovely software programs. If you have a Medicare plan now, or you want to see what's out there, we'll be more than happy to run we have a little program that does a little, you can email me, you can Zoom me, you can call me, and I'll be more than happy to run you a little summary of what's in the market, because every area, we'll talk later on about strategies, because there's an awful lot of strategies we'll talk about. But some of the strategies, you get companies, and I'll mention like Humana sometimes will change, and one year they have the Ruby plan, and then all of a sudden miraculously next year it's the Diamond plan, and that way they stay filed, but they offer different plans for pricing and for accessibility. And so there's some strategies on how to deal with that, and that's not a plus or minus, it's just how they do it. So you have to see what's available in your area, and we'll talk about that in terms of that. So unless you're with an employee, yes, ma'am. You can ask any question. Just don't ask me about the Giants pitching, and I'm okay.
Now, this question isn't for me, but I have many graduate teachers who will never get Social Security. Do they not get?
They get Medicare. And what do they do? Like STRS?
They're part of California.
Yeah, STRS. They get.
In California, they voted many years ago not to get Social Security. They don't pay it.
Right. No, they have their own, they have their situation, but they can engage in Medicare. Medicare's different in terms of that. The STRS.
Mike,
Yes, ma'am.
we want to make sure we repeat the question
Oh.
so people online can hear. Can
No.
you distill that down a little
I
for
got
me?
a piece of advice, Juanita just glared at me, but I got one piece of advice, and that was make sure I repeat the question, and I didn't do that. So your responsibility is, if I didn't repeat the question, just give me the nod and I'll make sure I repeat the question. Okay. So the
I'll help
question
out,
was,
Mike.
the question was, do teachers, like California state teachers, they were not participants in Social Security, do they participate in Medicare in terms of that? And I believe the answer is at that point in time that they have, they're eligible for Medicare. The question comes down to is, did they fill their 40 quarters? A lot of teachers worked their 40 quarters. And so, over their lifetime, that's the way you qualify, by the way, for Social Security, is you become fully vested over your lifetime. 35 years is what.
I'm fully vested.
Right.
35
and so if you worked for your, and you got your 40 quarters, then the penalty happens in your income from Social Security, where they have the Social Security, they call it the GPO offset. And every year there's always legislation to eliminate that. Once again, it happens every year. It's not going to happen. But if you finished your 40 quarters and you're eligible for Medicare, you can apply that. The penalty doesn't penalize that. So you get your choice there. Or with CalSTRS, I believe you end up with their, it's more like a Medicare Advantage plan with eligible for Kaiser in terms of that.
I've been working for 13 years as a teacher, so I do get returned.
Right.
I pay my own.
Right, in terms of that. And so in that situation but it's the critical thing on Social Security is over your 35 years, you have your 40 quarters. And if you have not set up at mysocialsecurity.gov, they used to send out every other year, and now they don't. It's online. And so it's real simple. And once you get it set up, please save your password. But it's a point where once you go online, it will tell you the first paragraph how many quarters you have or units. And so in terms of that, and so set that up and find out if you're fully vested, then you're fully vested, and you don't need 41 quarters, you need 40. And it's not about if you made, if you, I think it's $1,670 a quarter is what it takes to qualify as a quarter. So when you worked at Jack in the Box in high school at night, that probably counted as a quarter. So you would be surprised. And my other fatherly advice would be, if you look online and you have 38 quarters, I would go work somewhere for 2 quarters to get fully vested. That's all it takes, is getting your 40 quarters done. So anyway, enough of that. But anyway, thanks for the question. So if you work for a small employer, occasionally we get somebody who wants to stay on their health plan. And for a small employer, the cost for an individual or family is thousands of dollars a month for health insurance. So they want you to transition to Medicare as quickly as they can, whether they financially incent you or not is with them. But if you're under 20, you're covered you have to go on to B at age 65, A and B, and you'll get your little card. If you work for a firm that's over 20, then you could stay on their plan B. And we'll talk about pharmacy or part 2. We're going to talk about part D. Part D's prescription drugs. That's a separate conversation, where I think some of the greatest tactics to save some money is about part D, in my opinion. But so you have to enroll. Assuming you're going to enroll, when they say late, if you miss those 90 days after, you're then in a situation where you can pay a penalty. So you got 6 months to enroll. So take your time and do it anytime. It's not effective till your birthday. And once it's there, then you're eligible. You get a cool little card. I would suggest, you put a little laminate on it so it doesn't wear out in your wallet. But other than that, they'll send you a fresh one online if you need one. Make sure, I will tell you, when you go to your employer, in their handbook, they will tell you exactly how that works out. They deal with it all the time. And boomers are still an aggressively growing group. So there's good documentation. I had a friend recently that retired 2 years ago from Salesforce, and they hadn't had a whole bunch of people retire because they're a young, cool, hip company. And it was like, wow. He said, I'm not terminated, I'm retiring. And so you just, if you have an old veteran company, make sure that's not a slam on Salesforce. That was just, you have to look at your employee handbook, and it'll tell you the integration in terms of that. The Center for Medicare and Medicaid Services, CMS, that is the organization, the subset that we are talking about. That is what you get your mail from. It does not come from Social Security. It comes from CMS. And you'll get letters probably every other month that will give you a breakdown of your pharmacy costs, and it'll give you, once a year, you'll get a letter on your IRMA interaction. If you change, they take, and we'll talk about IRMA. That comes from your tax return. It's not something you have to fill out a form. But it is a subset of the Social Security Administration. This was, I think, an interesting point that people don't realize. So you have who's covered. So all US citizens, legal residents who have lived in the US continually the last 5 years. So it's a broad-based system. And so it's a situation, some people under 65 are in there if they're on Social Security disability. if you're on you'd be on Medicare if you get Social Security disability. And if you're indigent, you get Medi-Cal, that rolls into Medicare. But that's if you're on Social Security disability in terms of, that's a different world than what we're talking about today. It just means you're eligible for Medicare. Any questions on that? That sometimes gets people confused. And here is the mothership. This is what we're going to spend our energy talking about. You have Part A. What is that? Part B, Part C, and Part D. And so what happens is, so let's start, because I think this is foundationally critical. In your brain, Part A and B are here, okay? And Part D. Okay, if you have Part C, you don't have A and B. You sometimes can integrate D, but usually D is integrated in Part C, and we'll talk about that. So let's just talk about Medicare Advantage. So that's Part C. Medicare Advantage becomes your Medicare. So of those that haven't enrolled, how many of you have Kaiser? Okay, so how many of you are going to continue with Kaiser? So I'm just going to tell you that is the smoothest integrate. I don't work for Kaiser. I said I don't work for any insurance company. That is going to be the most invisible transition you'll have. So if you have any palpitation about going from Medicare to Senior Advantage, it's just invisible. It's like, you know, it's like if the rest of the business world worked as efficient as that integration, it would be good. You'll go, it'll just switch over. That will include your D. Kaiser then will be your Medicare. You won't deal with CMC. You'll deal with Part D. You'll deal with Kaiser. So does everybody understand that? That's kind of a cornerstone thing. And so if you're going to Kaiser or any of the Medicare Advantage, so I'll back up a little bit from 5,000 feet to 10,000 feet, is if you're enrolling in Anthem, you know, the big three, I mean, really consists of United Healthcare, you know, Anthem would be, those are two of the largest healthcare providers. You could get A and B and your supplement, or you could do C with Anthem, you can't do A and B with a supplement with Kaiser. Kaiser's always going to be Plan C. And that's fine. And you go there to member services and they'll take care of you, and you have a few little options now, but it's pretty much Kaiser member services is a very clean job. A and B, we'll talk about what supplement you get, and D. But remember, so what makes a Medicare Advantage plan? Medicare Advantage came out and they said that you have to be, you have to have equal or more benefits than A and B. So why would I go to, forgetting Kaiser, because if you're in Kaiser, it just is invisible. But why would I do a Plan C? So sometimes Plan Cs are less expensive because they sometimes send you the ability to, they get paid directly. They get their subsidy for your premiums that you pay. Medicare goes to Kaiser or whoever your Plan A is, your Medicare Advantage plan. And so with them getting your benefit in that situation, they're your resource. And so you're not going to interact with them. You're not going to get any situation where you're going to get a supplemental bill from Medicare. By the way, everything is always done by letter. Just let's deal with a quick fraud thing. You're going to get everything they're never going to call you. No one's going to call you. No one's going to, you're going to get a letter in the mail on your documentation. I think that's very important. And so when people go to Medicare Advantage, sometimes they price it because they get paid by the federal government. Then you don't pay a premium. So if you are fiscally tight, then or you're really frugal, and you say, you can go. There's a lot of Medicare Advantage plans out there that you don't pay a premium, and they usually offer other additional services, like maybe they call it silver shoes, or where they give you a gym membership. You know, they sometimes offer dental, sometimes they offer vision that you can add. And sometimes the challenge comes down to, if you like Dr. Jill that's over on Gregory Lane, they may make you go to Dr. somebody in Pittsburgh because they have their, it's really not a PPO situation, it's really an exclusive provider. So I will tell you, if you use a Medicare Advantage and you get their dental plan, for example, it's not Delta, it's their plan. And so you should just be aware of that. If you have a company, you're usually going to be able to keep that's one of the COBRA things I would exercise. No offense, if I'm with a company and they got a good dental plan, I would take the COBRA option, or if they let you have it as a retiree, I would jump on that, because the dental plans after that aren't as good as, there's pretty restrictive in my opinion. And so in a situation on Medicare Advantage, yeah,
I just got this from Kaiser.
okay, oh, there you go.
Um,
She just got a handout from Kaiser. See, I was on
for
top of that
every
one.
section, Medicare and what it does and doesn't do.
Uh-huh,
And I get a monthly statement from them. And before my surgery, October 2nd, I've already got the statement that says I'm paying.
yep. So she held up zero. She said she gets monthly statements from her, from Kaiser on her surgery, and she got a letter that said she pays zero. Go ahead.
I think that was my only comment. They do, I did look at Delta Dental, but most of my good dentist doesn't do Delta Dental.
We're going to talk about that topic a lot, because I think that is maybe one of the most important ones. She said, thank you. Whew. I was looking for you. You just shook me up. I know the big boss told me to repeat the question. She said when she got her list of Delta Dental with Kaiser, and her dentists were not included in that list. And that's why I said, I think that's a cornerstone. So in Medicare Advantage, one of the things that's very important is, if you have a doctor or a doctor's practice that you like, just next time you go in, make sure that they're going to take some physicians do not take Medicare, just so you know. Mine do. I'm down in Danville, and Blackhawk Medical just takes everything, and it's been just seamless. But please ask your doctor, if you have a practice, just say, I'm going on Medicare. This is the plan I'm using. Are we okay? Because what happens is they negotiate. There's things in both Medicare Part C and Part A and B called DRGs, diagnostic related groups. And in those that's what Medicare pays. And that's when they squeeze doctors on the DRGs. And that sometimes makes them grumpy. And so it's a situation where I would just make sure that you check with your doctor's office because Kaiser's no problem. You don't have to do that with Kaiser. But just make sure, because let's just take Anthem, for example. So there's Anthem, the big Anthem, the global Anthem. And then there's a subset in that is Medicare Part C. It's the Medicare Advantage group, and it could be different. And so just because they take Anthem doesn't mean they take Anthem Medicare Advantage, because that's called usually an EPO, or an exclusive provider organization. And these people contract out. And so just this is where you have to do a little bit of homework. We're going to do more homework on Part D, but when you're signing up, those are the simple things. Once you sign up, just want to make sure, do I do my C or do I do A and B? So in C, if you're going to do that, I would say one of the big issues is, if you're tight economically, sometimes you're going to save money in Medicare Advantage. It's going to be a little less expensive because you're not going to have to pay the Medicare supplement premium in addition. And there's a little bit broader coverage, but I don't think there is as much. And I think that one of the things you get to is, I think when you look at a Plan D Kaiser's going to be the same Kaiser as anywhere. But if you look at some of the other ones, just make sure, one of the flaws, pre-approval. If you're looking to get that knee replacement, the ankle replacement, you're getting something done, you make sure you get that pre-approval, and we'll talk about that in a second. That's just really, it's not something that you can necessarily, if you had that plan and you're there, you can wing it. You have to make sure you go through the steps with your doctor and they understand it. That's not something you have to educate them on in terms of that situation. But so Part C, so economic, you're going to get a little bit more benefits. Sometimes there's if you go to the eye doctor and you're in either one of these plans and you go to an ophthalmologist because you've had eye surgery, you've had cataract surgery, you've had any of those kinds of things, you have some microvalve issue or you have the, my brain's just shorting out on the, anyway, if you have any, thank you. That's why you're on the commission, macular degeneration. If you're dealing with any of those things, at that point in time, it's the glaring lights that froze me up. If you have any of those things, they're really good at letting you do your annual kind of review, and they just say it's a follow-up on your condition. I've never had a problem. I had some cataract surgery a long time ago, and my ophthalmologist is really good at doing that. So I don't have a supplemental vision, just so you know, because they're there. If you have perfect eyes and you're there and you need to do that, that's another conversation that you would have that in the vision. On dental, the same thing is usually when you have dental plans in Part C is they're going to be not comprehensive. If you had that big old Delta Dental because you worked for Pac Bell before and AT&T and it's just covered everything and they give you a massage when you go in and headphones and nitrous oxide, they don't do that on these other plans. So it's a point where you just have to be aware, and you're going to probably change dentists because they have an exclusive provider organization on a lot of those Medicare Part C. And the only other thing I'll say about Part C is that sometimes they change. And, when Scripps came up a bunch of years ago, they were here, they're a wonderful institution in San Diego area. They came up here and they incorporated and then they left. Well, then all of a sudden you have to find it. So let's talk a little bit about, for those that aren't new, you veterans of Medicare. So what happens? We have a situation where every year we have an annual open enrollment period that starts about October 15th and goes to about December 7th. And every year you get a free at-bat. You get to go up and change. It's guaranteed issue, guaranteed exchange, and you can change. The one option is they call it a special election period, which is if your plan changed or left or something, they'd give you a chance to change guaranteed in the situation. The one other thing in terms of special election periods is if you're in Kaiser, on Medicare Part C, I forgot this, you usually have to be within 60 miles of your primary doctor to be in a Medicare Part A. So if you move away from your primary doctor, that in a situation, you're going to go to Pahrump, Nevada. And there's no Kaiser in Pahrump, Nevada. And so I had a client do that. So that's why I can say that. Or remember, Chico doesn't have a Kaiser, believe it or not. If you're going to move to Chico, because that's where the grandkids are, they don't have Kaiser up in Chico. And I think they're talking about expanding, but so make sure that there's your healthcare is in that area, because in Medicare Advantage, the challenge comes down to there's always coverage for emergency in Medicare Advantage. If you're globally, you're traveling, you're in Venice, you're there and you need healthcare, I should have taken that back. You're in on the Mississippi River, because there is some territorial issues, but if you're in the Mississippi River on a riverboat cruise and you have an issue, your local territorial Medicare Advantage would pay the emergency to get you back and get you set. So Part C is there. So let's talk. So, and what's in Part C is going to be, or what's in Part A and B is going to be covered under this. So Part A is hospital. So that's when you go to John Muir, or you go to John Muir Concord, or you're going there. That part of the coverage is automatically integrated in everything. So here's a question. So all of a sudden you're in the hospital. What happens if, believe it or not, I know this will shock you, they're going to prescribe medications and drugs while you're in the hospital. So is that covered under Part D, or is that covered under Part A? Who said that? Oh, did you get an answer? There's your book for you. I'll get it to you. So she answered a question, so she got a book. Those that are cool and are here in person, we give a few extra things. So I just thought I'd let you know. In that situation, the point is so that would be covered under A. So it's pretty broad. And in that situation, and usually what happens is if you know you're going to be hospitalized, and I would say that's true if it's even if it's outpatient, in that situation where your doctor's office will get the pre-approval, but please don't, you have to get pre-approval. I'll say that 35,000 times. It just, you gotta make sure your doctor's doing it, and they'll tell you that you'll get pre-approval. And we'll talk about pre-approval on Part D in a second. So what happens then in a situation where now we have part A, and so now we integrate into part B, and that's where it covers doctors and all other ancillary medical things. And we're going to break those down a little bit more in a minute. So those work together. So now you're 65, you're off of your PAC Bell health insurance because you decided you wanted to go, and you're gonna, and so you have A and B, and then what do you get is you get a supplement. And I'm gonna make this really easy on the supplement. So wherever you go, whether it's United Healthcare, Anthem, Aetna, TRICARE, Blue Shield, you pick whatever the provider is, that supplement, basically, you'll get weird things in Medicare. It's like, we only cover 3 pints of blood, or we only do this, or we only do that. These supplements just kind of work like a glove and fill in the gap. So, I have Blue Shield because I had Blue Shield as a small group plan for my company. And then when I retired, I just kind of continued on, and it's just been seamless. And I will tell you, I've heard that about Anthem. I'm going to tell you, we used to have Plan F. So this is the easiest free advice you're going to get. Please do your work. There's a spectrum of plans, A to M, and you'll see that later on. And they give all these little options, and these people cover this. Real simple. Have a nice cup of Earl Grey tea, put a little milk in it, and sign up for Plan G. That's it. You don't need, it was Plan F, then it was F plus, now it's G. If you're gonna do the A and B, and I'll talk about why I did that, and you're gonna do A, B with the supplement, Plan G. It's real simple. Just, and I'll tell you, well, it's the broadest. It's just, it has worked. So and last October, I had a full ankle replacement. And what was the sign? What was your first name? Gail? Gail, how much did you pay with your Kaiser when you held up your hand for your surgery? Well, no, it was zero. Oh, okay, she paid a $10 copay. So when I had this ankle replacement, I thought it was going to be something. I had paid earlier in the year a $250 copay, and I paid zero after that.
I have a question on TRICARE. I understand that I would be eligible for TRICARE. My father was in the Navy for 35 years, and I was a military kid. I'm very happy with Kaiser, but is TRICARE something worth investigating?
So there is, I would say, so the question is, good job. The question is, she is eligible because of her father was in the military for TRICARE. She currently has Kaiser. Should she look at that? So here's what I think you can have a coordination of benefits. I'm going to tell you, with the exception of happy TRICARE people, I don't know TRICARE system. So I would suggest you would go online and ask them to do that. And so we encourage, and I think that's the same integration with VA benefits, as I would look to apply. If you're a veteran, as I am, they now have an income level that if you make too much, they say, thanks for apply next year when you make less money. And so, but I would look at, I'm sure there's some criteria, but I've just heard nothing but really good things about, for pharmacy. We have a really good friend with MS, and he was on his plan, and he does the TRICARE because he was, and so he's the other person that has good success. So that's not a commercial for them, because even though I'm a veteran, I don't think I'm eligible because I didn't retire. Anyway, so let's go part A and B. Remember, Medicare supplement, Plan G, close your book up, you're good to go in terms of that if you're going to do the AB. So why did I do A and B and not C? It's really because of choice. My wife is a retired person from Kaiser, and it's a situation where I like to have choice. So I like to be able to also, I like to be able to say, I want to self-refer. So I like that PPO concept. I like to have a little more control. And so because of that, I went A and B with my F, because I'm a grumpy older guy, and I was eligible for Plan F. And so now Plan G does this. The only difference between F and G, by the way, is a $250 deductible. That's it. It's the same thing. So you're not any slighted on any benefits. And so to me, it gives me control and choice. And that's why I do that. And I haven't regretted that one day in terms of that situation. But I do pay for my supplement every month. And so that's the difference. And so when I said, if you're trying to be fiscally a little more responsible because you're on a tight budget, that's where Plan C really works. Okay. Or if you're a Kaiserite and you go, that's just, I love the system. With any Medicare plan, A, B, C, D, can I just assure you, you need to be a medical consumerist. Please don't abdicate those decisions. Be intentional. You have to go manage your healthcare. You have to ask you, whether you're at Kaiser or whether you're anything else, please equip and educate yourself. I just think, I call it ostrich financial planning doesn't work, and ostrich Medicare planning doesn't work. You have, ARP has some great resources. That's not a commercial for ARP. I have no quid pro quo with anybody, just so you know. That's why I'm a fiduciary and I just do my thing. But it's a situation where with the supplements, they integrate well. ARPS, I believe, has a relationship with United Healthcare. I think that's the biggest supplement out there. And then Anthem is probably second in terms of that. There's a lot of Fortune 500 companies that have Aetna in terms of that. But I would just do, and I think that sometimes if you're with a large company, they'll give you multiple options. And I will tell you, there's a little, we have the software program. If you, like I said, if you signed up, you're going to get an email of my contact information. I'd be more than happy to run a printout for you. It's no big deal. Just tell me you were here and off we go in terms of doing that. Let me go through. I am so far behind, but this is kind of easy. Let's just give me a second here.
Mike, we have a question back here.
Okay,
Yeah, this is for a friend of mine. It's not me.
same friend as Gail has.
No, no,
Okay.
this person is getting Medi-Cal
Uh-huh.
and they're going to turn 65 next year. And so they would get Medicaid, right?
God, well, Medi-Cal is the state. So question is, almost missed that one. The
Mhm.
question is that, what's your first name?
Diana.
Diane has a friend who is on Medi-Cal, and when they turn 65, will they automatically go to Medicaid? And so the answer is, since I teach Tuesdays at the Bay Area Rescue Mission, I deal with this question all the time there. And the issue comes into is they will stay on Medi-Cal. They won't automatically, because they'll just be in the senior. They won't go to Medicaid, because Medicaid is this California state version of, or Medi-Cal, excuse me, is the state version of Medicaid. Okay, it's the same thing in terms of that. And they do have open enrollment every year in terms of that as well. But good question. Anyway, you get a book. You ask a question, you get a book, I have a lot of these books in my office, and I was leaving. I said, I'm just going to bring the book. So anyway, they have nothing to do with what our topic is, just basic financial planning stuff. So here's the simple chart that just shows the separation in terms of that. So when you get that Medigap or Medicare supplement insurance, if you look at the bottom of the screen, we're in a point where that's where you're adding that integrates and supplements. And so A and B, and then you buy the Medigap that fills in the gap. Anybody have any questions on that? That's a foundational concept. Okay, are we good? And then we're going to go, yes, ma'am. When you have one, it's just like, she is like the bomb diggity. So the question was, can we make it larger for those really brilliant people that came here in person? And Juanita was able to do that. So anyway. Okay, so this is, I think, the cleanest look. You have this. Now, in your part C, just make sure that with Kaiser, I know D's integrated in that and in terms of that. But just make sure that you in turn you get that part D is integrated in terms of that. I'm going to skip through to get coverage starts the first month, you age 65. I would kind of say one of the good things to do if I was, I have a lot of people that do 90 days before because they're kind of nervous Nellies. No offense to Nellies. I would say that usually I just do it. I did it the month before and it worked out just fine. And you go online and you sign up and it's just really clean and neat in terms of that. If you wanted this PowerPoint, I have no problem emailing it to you. Just email me and say, send it to me. It's no problem. So anyway. Oh, see, because Juanita's way smarter than me. That's thank you to the Commission on Aging. So anyway, C and D are not automatic. That's important. You're gonna sign up. You're gonna make an intentional act in terms of that. I see most problems in signing up is on D. I'm just gonna tell you that. You have to do, that's where most people don't realize there's an extra step you have to do in terms of that. You sign up through the Social Security Medicare enrollment. When you go online, mysocialsecurity.gov, there's this thing Al Gore invented called the internet. It's pretty cool. And you just go on and you type in enroll Medicare and Google will bring you, or Safari or whatever search engine you have will go right there. And it's going to be .gov, and you'll sign up and you'll set an account up and you'll set up a Medicare account, and we'll talk more about, it's a really comprehensive, powerful. I was at a coffee yesterday and we were talking about, a lot of times we like to smash our government around for what they do. The Medicare website is really an excellent, excellent website. And we'll talk about how if you're frugal and you want to manage your prescriptions, we'll talk about, I think the Medicare.gov website is really amazing when it comes to prescription management. And so we'll talk about that. But here it is. There's the initial period you enroll. Once you enroll, you don't have to re-enroll. Once you're in, you're in. You get your little card, little tattoo they give you. It's henna, so it'll wipe off. Don't worry about it. I'm teasing. And then you have your special enrollment period. That's if you moved or you in turn were in a company and they left and you retired. You'll get ample opportunity. It won't sneak by you. And just so you know, your company has liability to make sure you know that you have to enroll in that second thing, in terms of that. And remember, you have open enrollment each and every year. You sign up. This is another snapshot of that. You can, if you miss it, because you were so raptured with the San Francisco Giants that you missed the open enrollment period, you have 2 or 3 months after you have 3 months actually. I don't know why it says 2 or 3, but you can enroll. And remember, your coverage is the next month. There's no retroactive coverage with Medicare. You understand, if you sign up in September, even if your birthday's in August, you don't get coverage in August. So you get coverage the next month. Everybody understand that? Any questions on that? Okay. And so if you nod one more time, you get a book. Okay, right behind you. You went for your hair one time, sir, but she nodded twice. So you're going to get a book if you nod one more time in terms of that. I don't want to carry him back. You probably got the idea on that. Okay. So anyway, part A, you sign up, you're in a situation where you enroll in HSAs. Do you have an HSA? Oh, I missed that one. Sorry about that. Okay, then health savings accounts, you do? So those have, they're going to end its existence when you get in. The Medicare isn't integrate with an HSA. It's a great savings account. You don't have to distribute. You can take your funds in an HSA for a lot of, it's really broad. Any Section 162 deduction, you can spend it for a lot of things. You can get that massage for that neck, that problem you have, all that stuff. You can use your HSA, but not Medicare in terms of that. So if you have it, don't fret, you can still use it, but they don't build a Medicare supplement with HSA integration. I wish they did, by the way. We had HSA forever. It was a lovely thing. Okay. Part B, people who are not covered by a comprehensive employer-sponsored group. What's your first name? Aaron. Like Aaron, and you work for a firm that has 20 employees or less. When you turn 65, so it's the issue is who signs up during the initial enrollment period? People who are not working, people who are self-employed, people employed by a company under 20 employees. If you're on COBRA, now you could be on COBRA for lots of reasons. You could be on COBRA because you left the firm. You could be on COBRA because your spouse passed away. You could be on COBRA for you were divorced. There's lots of COBRA options. So if you're on COBRA, you could transition and you hit 65. You're receiving retiree health benefits. What if you were like Gail and she in turns retires, when she was 52 because she was brilliant. And all of a sudden now she's in a situation where she hits 65, she can then apply at that point. Or you're employed by company who is less than comprehensive than Medicare. That's the phrase, it's less comprehensive. And you get sometimes people, and I won't slander other insurance companies, but there's a group of them that that aren't insurance plans that some people have, and they have ducks that market for them. They're not comprehensive health plans, okay? They're just cash reimbursement plans. So in terms of that. Let's see. People who sign up for Part A and B and want prescription drug coverage now or in the future must sign up for Part D. Now we're going to start with Part D. Thank you. Part D, there's two parts. So Part D, George W. Bush, he initiated this part of the plan of adding to Medicare to cover prescription drugs. So anybody can tell me there was a major big pharma law that passed about 3 weeks ago that's directly going to benefit everybody. Can anybody mention what the federal government negotiated with big pharma about 3 weeks ago? There's a book involved. What? Negotiated price settlement. Otherwise I'd get up and run and that'd be too many steps in a day. So we'll make sure you get one afterwards. But negotiate, what happened? There was a negotiated price settlement. So if you go, why do Marion, I know would ask, why is Canadian drugs less expensive than US drugs? Because the government negotiated prices with the pharmacy companies. So this is the first at bat where they went to big pharma, and you can Google it, and it'll show you the 10 drugs. They negotiated 10 drugs that's going to save Medicare $6.8 billion, and it's going to save out of pocket $1.6 billion. So it's a situation where, and they're going to add 5 a year from what we understand. They're adding 5 next year. It is a spectacular thing to bring some of the costs of prescription drugs, but this is what's in there. And you have 2 options. You have standalone prescription drugs, or basic, they call it usually, or enhanced in Part D. Medicare Advantage, they usually just embed it. If you have Kaiser, it's just included. You still go to Kaiser pharmacies. But we'll talk about those 2 in a second. But Part D, you have to enroll in. Otherwise, if you don't roll in, you're in a situation where you're going to start getting a penalty, and your premiums will go up for your lifetime by 1%. So if you like paying the government 1% more just because you were delinquent, please do. Otherwise, you need to sign up. And you can sign up for the most basic plan, or if you want to avoid pay, go into a Medicare Part D where it's integrated and you don't pay an additional premium, and you can be frugal. And then when you hit the lottery, you can, at next open enrollment period, you can transition out, okay? So I'm not going to cover this because we're cruising along. Special Part A and Part, this is if you have other things you can enroll, and if you have special enrollment periods. We're just going to continue on. Let's see. We're going to go through here. That's the website. It's www, for those online, .ssa.gov, or Google it. And that's it, or you can call. It's really, if you don't have mysocialsecurity.gov, it's just such a cool little website. You look at it once a year, you're good to go. It's not something you have to look at annually or weekly, weekly or monthly. So this is how, if you decide you go A, B, and D, or C, that is the decision. Those of you online, take a photo of the screen and you'll be good to go in terms of that. That was a little humor, sorry about that. Anyway, and Medicare's phone number is 1-800-633-4227. And that's really how you can decide if you want to ask Medicare what they're doing. So you have A, B, and D, and D. I'm not going to go through just because I want to unpack Part D. These are, believe it or not, where they spend money on your private healthcare. And it's pretty amazing when you talk about premiums versus services. We still spend more money out of pocket than we do paying for premiums in America today in terms of that. And some of it's long-term care, some of it's medical providers. When we do plans, when we write plans for people, we usually allocate 10% of net worth for medical expenses as you age. So if you have, so I mean, it's a point where we put that in every plan. It's going to be a significant number for out-of-pocket going forward, and it increases. And that's not for covered expenses. Yes.
Is that, I was wondering, is that per person?
Yes.
Okay, that's.
Well, and that's a great, we'll talk about that. What,
Mike?
question, oh.
I'm going to
No, I'm
get you
gonna
every
get-
time.
I'm going to get a demerit. I know this. Anyway, and Cammie, I don't know if you Cammie, she's like 6'6", 260 strong. She'll just gonna slap me around for not asking questions, so I apologize. Anyway, so the question was, I posted a number that said total out-of-pocket coverage individual, this was 2016, I can tell you it's gone up, is 5,460. And the question was, from what's your first name? Alice?
Allison.
Allison said, is that per person or is it per like family or couple? And I would say it's per person, but I will tell you, married, the challenge comes down to is sometimes when you have a partner, you're in a situation where it's more like 25%. I think it's not 100%. I don't think it's $10,800. I think it's more like probably like 7,500 because you have shared expenses and, you know, in terms of those things in that situation. Allison. Okay. So in monthly premiums, so this is the big cost in C. See, notice it says you pay to Medicare, you have A, you pay a little bit for B, that 174 unless you have IRMA. So on the screen, so the IRMA's 174.70. They changed that IRMA. IRMA's a tax, okay? And it's based on when you file your tax return, it's based on your adjusted income, adjusted tax that you pay. And so if you make more, there's a phase-in schedule, and I think I'll show it, but I'm not going to show it here. That goes up. So you could pay, you know, online or on the website, it'll show you, I believe we're going to show the phase-in, but you're in a point where you're going to pay, you'll pay more. There's a tax based on means in terms of that. And so D, the premiums change because you're paying them to the private insurer. So when I talk about D, remember there's a basic plan, an enhanced plan, and they have different names. You know, some people they call them diamond and whatever, 10, I guess. But anyway, it's a point where you're going to pay very little, $15 a month for the basic plan, and you may pay $135 a month for the enhanced. Significant difference between the two. So make sure, and we'll talk about how you decide that. I think that's the hardest decision in all these conversations. There you go. Your Part B IRMA. If you make between, you know, if you're married and you make between 322 and 386, you're going to pay not 174, you're going to pay 279. And being a retired, yes, ma'am.
If you have Medicare Part C, do you still pay IRMA? Because you said
You're going to pay a premium. Yes, if you had, the question was, that was so close, wasn't it, Cammie? The question, and what's your first name? Janet, who has TRICARE, says that if I'm on Medicare Part C, will I pay a IRMA? And I believe, yes, the answer is you pay your IRMA for Part C. If you make more income, you will get that, you'll get a bill in terms of that.
I was just wondering because if you're on Part C, you don't have Medicare A and B.
Yeah, but it's their subsidy. And so I think this is a means test.
Adjustments will be reflected in your Part B.
Say that again?
The adjustment it will be reflected in your premium when you get your Social Security income.
Yep.
Then automatically the Part B premium is there and it is higher
Yep.
than the basic amount.
Yep.
Yeah.
So that was a statement versus a question. So Cammie's not going to be mad at me. And so in the statement, the issue she said was it's going to be reflected when if you're in your Social Security system. So when you get your Social Security, you can automatically takes your premium out. They really arm wrestle you to do that instead of having it separate. So that was where you will get reflected on what they charge you. So I don't think that's a great observation, though. I've never been asked that question. That's a good, in terms of is IRMA avoided if you take Part C? I'm going to make that same, but I'm going to actually look that up by about 2 o'clock. I'll have that confirm that. But I believe the answer was, because I don't think the government ever avoids the ability to tax. So you have deductibles in terms that sometimes your supplement or your Medicare Part C pays those. Okay. And so that's why this is, if you don't have a supplement, this is what you would pay. Okay. That's why you do a supplement. If you're going to be on Medicare, you either need to do Plan C or a Medicare supplement, because it's going to, these are some of the costs that you defer. So when you do your Excel spreadsheet and you say, what are my actual costs going on? If you're paying, $180 a month for your Plan B and A supplement, you offset it by your deductibles and things that are covered by your supplement. Co-insurance, this is the big one that's covered. Of course, in a Plan C, you're not going to have co-pays. Traditionally, you'll just have a per visit $10, I think Gail had. And so in that situation, you're going to get, this is what you get your report on, but when you have a supplement, this is what's picked up in your supplement. And it would be just, I know that you're online, you don't see the picture. I think it's just audio. Oh, they see the picture. Oh, good. Here, I was thinking I had to read. I won't do that. So in terms of that, so let's talk about Plan D. These are the ones without, and you don't have a supplement. You've signed up, you have Plan D, you're going to pay the full Monty, the $545 deductible. You got 25% copay up to out of pocket of $8,000. And there's a donut, which we'll talk about in a minute on Plan D, that if you hit that magical donut, you end up having another significant expense in the donut. That's what they call it, by the way. It's a hole. For some reason, that's how, when Congress built Plan D, they did it to make it actuarially sound. So anyway. Hospital, medical services, we'll talk about that. I'm going to keep going. What it doesn't cover. What does Medicare not cover? Long-term care. Anybody not understand that? I will tell you there's 100 days where there's some coverage, but you have to have restorative care. And every Tuesday, that's where it is at Manor Care with my mother-in-law. Every day they would say, is Joanne getting better? And if she was, they were good. And then after a while they said, nope, Joanne's capped out. She's not getting better. And so then they say, we don't get reimbursed. Therefore, you don't get to stay unless you want to pay for it personally. Healthcare delivered outside the US. You said Aaron? Yep. So when Aaron is traveling in Venice like he was originally, you need to make sure you have international coverage, and there's a zillion places to do that. But that's where it's a point where Medicare doesn't cover you there. If you have an emergency, it's a situation, that's when you want to get back to the States to get that coverage. So anyway, dental, that's where Medicare Part C covers that. You can get some freestanding. If you have A and B, you could get some freestanding. Vision, that's, hearing aids, cosmetic surgery when you're in that situation. And so there's a couple times where it is. We had a client recently who I have them too, you get some droopy eyelids and all of a sudden the ophthalmologist says those are blocking your vision, so it's medically necessary. So ask in terms of that. Acupuncture alternative, there's an area of conflict. I believe if you have Kaiser, you get some of those coverages built into your Kaiser on acupuncture and alternative. And so that's one of the things I believe you need to check that. Amounts over Medicare approved amount. This is the stickler. If you go to your doctor and you're getting something done and it's not pre-approved and they don't agree to the fees, guess who's liable for that difference? Just because it started in Medicare doesn't mean they're going to pay all of it. So please, please, please make sure you have that pre-approval. Anybody not grasp that? That's really essential in terms of, and guess what? I've had zero problems. I mean, since I've been on Medicare, I had an ankle replacement, I had a knee replacement. And guess what? Spectacular. All the PT, everything is just been great. So it's, I wasn't breaking down. They were just, one was an old sports industry, one was an Army injury. So it took a long time to get it done. But those are the things that aren't covered, and amounts covered by deductibles and copays. That's why you have a supplement. That is why you have Plan G. Okay. Yes, ma'am.
So is there any coverage for travel in the supplement?
In the US, that's a good question. I don't,
Mike,
the question is,
do we have any coverage for travel? Where is that coverage, Mike?
if there's coverage, the question was, is there coverage for under Medicare, under travel? What?
In the supplement.
In a supplement. And so that, you know what, first of all, it would be an individual case by case. That's a very, very, very good question. And I'm going to tell you, I'm going to punt on that. I'm actually gonna, because when I go abroad, I usually buy international coverage because I know I'm gonna get, if I get treated abroad, it's gonna be more emergency and then the cost to get me back here. And Peterson International, there's a bunch of them out there. And if you can do that, but what if what if I'm there and I can't travel back? That's the question. And because to getting air vac back here, it's about $8,000. It's not an inexpensive thing. And most of those international programs, will cover that. That's a good question. So I would say that's going to be this is kind of a wimpy answer and I apologize. It's going to be a case by case. Yes.
Where before that Medicare does not cover that.
Oh, no, we're talking about supplements.
Oh, the supplement.
Yeah, no. We know Medicare doesn't. The statement was that Medicare doesn't cover international, and absolutely Medicare does not cover international. The second question was, does a supplement cover that international? I think that's a great question. And if I was looking at that, I would look at maybe some of the really, and I would call them, for lack of a better, Cadillac kind of plans like Aetna. I think, that's maybe one that I would look at. That's a good question. I would look at that. I'm gonna actually look at my software that we do. That's gonna see if it picks up. If you email me and say you asked that question, I'd be more than happy to give you my response on that one. Medigap policies, they're sold by private insurance companies. It's the season. You're all gonna get 430,000 pieces of mail, 16,000 TikTok ads and Facebook ads and LinkedIn ads and radio ads, to go get presentations for that in that situation. And so, and you could deal with the broker to do that and they can give you options, or you can deal directly with the carriers. Please don't call me because we don't sell it. So anyway, we used to, we just would refer out to the brokers in terms of doing that. I'm going to jump ahead here. Can you make that large? So this is when I was talking about, I lied. It's not Plan M, Gail. Don't hold me accountable. It's Plan N. It goes to N. They've killed a few along the way, but this shows the Medigap benefits and what's covered. So when you see on Plan G, if you go down to skilled nursing facility, that's where I'm talking about the first 100 days. That's all. And so it shows deductibles and copays. You can't buy F, you have to buy G. And so that's where the $250 deductible is on Plan G if you go about 3/4 of the one down. But other than that, they're the same. Any questions on this? This is kind of if you want to gaze at that, you can gaze at this, but this is in your Medicare booklet that you get every year. This is online. You can, I think it's, you can get this spreadsheet everywhere, but it's really Plan G. So if you have that hardcore engineering analytical side, you can look at all these, but I'm going to tell you the answer is Plan G. What's that? Oh, there you go. Up to plan limits. So there you go. See the bottom one, 80% travel emergency up to plan limits. So every supplement's going to have a subset in terms of that. Thank you. So they were talking about, you may have a network. We included prescription drugs. We've kind of gone through some of the stuff here. So Medigap policies aren't standardized. They have to have some basic federal, they are standardized, excuse me. They have to have some basic cover. Everyone has to have the same coverages, and then some add a few extras. Medicare Advantage is famous for adding some additional coverages. And choose your plan. I want to continue on to Plan D. So when you look at the budget for what you're planning for your healthcare, you're in a situation where that's a pretty accurate budget, where you have your Medicare Part B, and then that's where they add the IRMA calculation on top of that. And then you have a Medigap premium. I think I pay $220, I think, for my Blue Shield. And then my wife's Plan D is less than that, and my Plan D is more than that. She's on one prescription drug, and I'm on 4 prescription drugs. So in that situation, and it's still way less than I paid with private when I had a group plan at work. Probably not yours, but with mine, Aaron. Okay. So when you look at budgets, this is the challenge. Where are you going to do some out-of-pocket dental stuff? Are you going to do some of this stuff? You know, these are some basic things when you look at your planning for in retirement, as well as in your situation of what can I expect to cover? You know, and that's where you get alternative care. That's if you're going to a chiropractor or something like that. You know, that's where, and you can, you know, this just gives you an idea. This is not a definitive group. If you have a dental plan, then you're going to have different, you're going to have, you're going to have your premiums minus some of the costs. Then you may have some copay in terms of that, and same with vision in terms of that. Oh, okay.
Dan, go ahead and, unmute. There you go.
Hi, Dan.
Hi there. I have I enrolled many years ago in Plan J, and there is no Plan J anymore, so I'm not sure what I have for the supplement.
Can you just repeat it, Juanita?
Yes, I have a supplement plan through AARP United Healthcare called Plan J. But I didn't see that on your list, and I don't know if it still exists, but that's what I'm paying for. And I've been very happy with it.
Sorry, Dan, we're trying to fix the volume. Just a moment, please.
Is it Dan? Hey, Dan, can you hear us?
I can hear you. Can you hear me now?
Oh, he sounds really, yeah. Don't know if there is something.
That was a good question. I never looked at that bottom one, and we travel, my wife and I, you know,
We
with
can
that age,
barely
and
hear
so.
you, Dan, so we're trying to fix it.
That's, I appreciate that. So I usually buy Peters International. That's not a commercial for them. I pay in, or sometimes when you go on cruises, they'll give you a link to international care. And so you can find those. There's a group of them out there. They're usually not, just so you know, they're usually not insurance companies. They're usually just kind of a business, so to speak. And the main thing is to get you back to the States so you get that coverage. But when if you're in Italy and you're in Tuscany and all of a sudden you're at a point where you do need to be hospitalized because you have a cardiac issue or you have a whatever, that's the thing, is how do you get stabilized before they send you back? And that there's cost there. And by the way, we've had some people have had really fine experiences abroad with in certain countries. I think the Netherlands, you pay zero because they don't charge for healthcare.
Dan, you want to try to speak? We changed the settings.
Can you hear me now?
Well, not
Can you hear-
quite. Hold on.
No?
Maybe I can ask a question.
Sure.
So in my case, I work for a big company and I'm getting.
Right.
health insurance
Understand.
and right now I'm
He's there.
at Kaiser.
Right?
But
It's
later
his
on when
mic.
I retire and I will be.
Yep.
I will be 65 next year.
Yep.
And then I retire, let's say it's 67 and we move to state.
Yep.
And they don't have Kaiser.
Right.
So what is your recommendation? Should they switch right now to like Blue Cross?
Do you love your Kaiser docs and everything else? Or does it make six one half dozen or another? Well, we were just chatting while Dan was doing that. So.
It's a. Okay, so my question is, from the planning perspective.
Sure.
Should I switch right now to a provider that I will have in a state that I move in the future? Or should I stay right now with Kaiser and then when I'm 67 and when we actually move, then I switch?
So Aaron asked an astute question. He currently is 2 years away from retiring. And he said he's on Kaiser now. So if he's going to retire, and he looks like he might possibly switch, and because he's going to travel, et cetera, does he switch now or does he wait until at the end and travel? That's a great question. So I would have two observations on that. If I loved my Kaiser relationship and my doctors and I know how to use the system and everything else, I would stay. You know, if you're being diligent and you're saying, well, I'm going to be in a different universe because I'm not going to be able to access my Kaiser the way I want to. So I'm going to change. And then you want to kick the tires on the new doctors because sometimes you got to change doctors to find the ones you like. I think it's a pretty prudent, responsible thing to do to find the medical practice that you want to work with in terms of that.
Yeah,
But-
the question is more from, planning so for example, another provider, can they say, oh, we cannot accept you because you have pre-existing conditions or whatever?
That's a good question. No, the carrier usually, go ahead, we're just going to finish this one. He asked the question about if he's changing to another medical practice, if he's going from Kaiser to another firm, can they deny him because of pre-existing condition? That's why we have open enrollment. That's what starts October 15th and goes to December 7th. Then they can't do that. If you did it in March and you said, I want to change, they don't have to take you because of pre-existing condition. So in your company, if you have open enrollment, which doesn't have to be October to December, it could be another time based on when they establish them. At that point in time is when you would make that decision. But unless you have what's called a special election period, they transferred you to Omaha and Omaha doesn't have Kaiser. Just a second.
Just letting you know I have another question back here.
Yeah.
That's all.
I just want to go back to Dan. Dan, I'm sorry, it seems like it may be the microphone on your end. We don't see anything on our end. Perhaps you could try calling by phone with your question. And
I'll get
you
back.
could, a phone number that perhaps is already sent to you in the email, but if not, if you could call 929-436-2866, then we can take you that way.
So let's see, where do we leave off? So so you have to wait till there's open enrollment to change plans, okay? Otherwise, unless it's a special election period where you're moving to Omaha and they don't have Kaiser, at that point, that would be a special election period. But I do think it's an interesting concept. If you want to kick the tires on a new doctor's practice before you did that, they're not going to, I've not heard in the Bay Area, doctors booting you because you went on Medicare for your existing doctor. I just have not, I've not had that in Contra Costa County, for example. I just have not had that. I've had no clients do that in terms of that. Yes.
I have AARP United. I've had no problem because I've been on it for a while. But I have people that switched from Kaiser to United Healthcare because they wanted to pick their own doctor, and they cannot get doctors.
And say that again?
They cannot get doctors. The doctor,
New patients.
yeah,
Yes.
it's like they wait months and months.
Yep.
Yeah. I mean, I'm talking like 4 months.
Yep. I think something. So the question was, the
Yeah.
observation was, it's Diane, right?
Yeah.
So Diane said that she has a friend that switched from Kaiser to United Healthcare, which is AARP's endorsed product. And they could not find doctors that would accept them. So when you go, and that's a great observation because that's 100% true. That's why when you have the doctor in advance, so you would do the 2-year, or you did it now, you're not enrolling as a Medicare person, you're enrolling as a client, a patient. So some doctors' practices, they can take patients. And so the question comes into is, that is a real issue because there's certain practices that are open. And there are certain practices that are defined by, you have to go to an NP or a PA instead of the doctor, that's nurse practitioner, physician's assistant. And that's a really great, thank you for sharing that, Diane, because that's a real issue. If you moved into the area, you're going to have the same issue. It's not because you moved from Kaiser to something else. It's because you're finding that. And the suggestion I would have to anybody doing that is, it's when you go online, if you go to every doctor is part of a giant doctors group, which has their giant doctor website, and you go on there and it says, these people are open to new patients. The other thing I would do is I would get in my car and I would go to the doctor's office and set an appointment up and do it face to face. We've had some clients that have had success in doing it that way, the old school way, and say, hi, my friend Susie, really likes you and I would like to go with my friend Susie or whatever the case may be. That's a really, thanks for sharing that, because that's a real issue in changing, which would make me want to do that earlier, because I do think they usually, the question is, will they take Medicare people or will they take any people? And you'll be able to find that out in terms of that. So anyway. Did Dan come up with a question, or we're gonna roll on? Okay, can you give me back to my screen? That's a good question. I forgot that. So let's talk about Part D. You have to hit that enable editing to go to, see that little yellow line, go halfway up, 3/4 of the way up. Okay, thank you. Okay. Rising healthcare costs, did you know the inflation rate as of 2 weeks ago was about 3.1%. New York Times said it was 2.95, but that's not true for healthcare. It runs at about a 6 to 9% clip, significantly higher than the consumer price index, just so you know. And so that's where those services come out. And that's why it's the issue of doing that. And so you're going to find, as Carrie, one of the reasons I was very happy about it, it's prescription drugs. There are only 10. And if you're on those 10, that's really spectacular. If you're not on those 10, you got to wait till the next year's 5. But that is a real positive sign in terms of that. I want to talk about the strategy and just my clicker's not clicking. Was it something I said, Juanita, or you really want me to spend time on this slide? Okay. We're not going to talk about the rising healthcare costs because they're going up. I want to go back because I think the next slides are on, what slide are we on? I think these are long-term care. I was trying to look, no. We're going to go back on Plan D, excuse me. So here's a strategy. Drug plan costs very differently. If you go on the Medicare website, and if you have a laundry list of, when you're buying your Plan D, you can go on the Medicare.gov. First, a couple things. You do not have to have the same supplement. Plan A and B could be, for me, Blue Shield. And you can have Humana for a drug for Plan D. They do not need to be the same, okay? So if I was I would find the Plan A and B that worked well with my doctor's office that I've been happy with, but it's okay to be kind of aggressive because I think prescription drug is more of a commodity purchase. You're going to get it prescribed, and does your prescription drug do that? So how do you know? So this is where I would invest. I know that sometimes we get tired. This is, if you're going to invest energy, invest it in prescription management on Plan D. You go on the Medicare website and you can pull up every plan and how they treat. There's things called formularies. So there's tier 1, tier 2, and tier 3 in the formularies. And so if you want your drugs to be tier 1, because they pay more for it. And tier 2, they pay a little less. And tier 3, they pay a little more. So I take a blood pressure medication. And it's, so in that situation, I can go and I can find it in certain plans, it's tier 1, in certain plans, it's tier 2. Well, the cost to me is going to be significantly different. So this is where, if you have your list, I literally want you to take your prescription jar that you have, so my 40 milligrams once a day of a Darby, I put that in front of me, and then I start searching for a Darby, and I find the places. If I was, I like that it's such a pain. Ways you can save money on prescription. One is by using mail order. Sometimes you can get 90-day prescriptions in mail order. I will tell you, those without gray hair will probably get some gray hairs in getting it set up correctly. But once it's set up correctly, it works pretty smoothly. The newest darling on the block for all those that like their Amazon is Amazon's jumped in the pharmacy business. When I do my physical or how do I do this? I don't do a physical once a year. I do my review with my physician on my blood pressure. So then it's covered under Medicare because they don't cover physicals. They do one time. And so they do it by reviews. In that situation, I will tell you, and he does check my blood pressure. He's not doing anything illegal. The other thing is the important part on this is that I'm going to ask him to prescribe 2 of my meds on Amazon. Because I wonder what happens. Here's my question on Amazon. It sounds like a great thing and they deliver at my house regularly. I think we almost have an Amazon stop with a father of 4 daughters. I will tell you that. So, and so in that situation, the issue comes into is what happens if you go to the doctor today and you need this med today? You need a series of antibiotics, a cycle of antibiotics. So how soon will they get it to me? I want to go to CVS or pick your pharmacy. And go pick it up and start so what happens? And I don't know the answer to that question. So I will, in mail order, you're going to have a delay too, but it's significantly less expensive on mail order in terms of that. And so I would that's one of the things you're going to have to manage. And if you have some urgency, if it's a situation where Diane needs a pain med and all of a sudden Diane's in a situation where she in turn wants that pain med now, she doesn't want it in 2 days or 3 days. So that's where it's a challenge. And I don't know the answers to that question, but in the website, if you're taking for whatever, an acute or a chronic condition, and you go there and take your prescription and go on the site and see which plans in your area. It will show you plans in your area that are open because there may be, a Humana Tokay plan in Omaha that's not yours. They may have Ruby here. I mean, and perfect in terms of that situation. And so the issue comes down to is shop in the Part D is where I think you're going to find your most savings. Because you can get, if you have the enhanced version, you can pay $200 a month. If you're on a whole basket full of drugs, sometimes it's worth paying the $200 a month. If you're on my wife with one, and now they put, everyone has their statin. And so you're a point where it's $2 a month. She said, I don't really want to have that. Well, I forced her to have the basic, so she pays the $14 a month. And so in that situation, be a consumer. So summary in this situation. So first of all, if you would like to have a conversation about yours, you can email me. It is mmfm01@outlook.com. I will, that's my, and I will be more than happy to I'll give you the printout of your Medicare plan. Just send it to me. Just don't expect it the same day. But I will be more than happy to give you a little printout on your plan. We have a separate program that we analyze that we do for clients. If you would like, I will send you the Medicare supplement, the handout, excuse me, in terms of that. So I would say the high points, shop your D. A and B gives you more flexibility. When you do a Medicare supplement, I would recommend G in terms of that situation. And please be a consumer. It's okay to open enrollment is coming. And this is really when you're going to be a chance to change. If you don't like your current plan, that's when you can make your change. And those in the back, there's just a little handout on caregiving that's unrelated to this. I just like it. And we do that. Any questions in the last? Yes, ma'am.
So when a person turns 65, continues working. But the government provides.
Yep.
Disability insurance.
Yep.
Can they decline Medicare?
So the question was, if someone is working for a firm that has good insurance and they're going to continue working past 65, can they decline Medicare? You have to do Part A. You have to do Part A. Part A, you're going to sign up for that at 65, okay? You don't have to do Part B. That's the one that has the cost, okay? So you have to do Part A. You don't have to do Part B as long as it's consistent, it's comprehensively similar. And if you're with a standard big health plan, you're fine. I've never, one time, and it was usually that duck company that they thought was their health insurance and it wasn't. Other than that, it was a situation where I would just, you want to have that to take care of your thing, but you can't, and Part D would be included in your current health plan.
You send a proof of your insurance to Medicare?
No, you're going to sign up and when you fill it out, they're going to ask you that question. You'll put that stuff there in terms of that.
You're insured.
Yes. Yep. So that you'll fill that in when you sign up, but you need to still sign up.
Even if it is right now covered by Kaiser.
Yeah, no, you're just gonna, but you have to, at 65, you have to sign up for Medicare. Plan A, not Plan B.
And Kaiser will provide a similar, a
Well, yeah, exactly. It will be, since you're talking about that, you still have to sign up for Medicare though. That puts you in the system.
Yeah.
So,
That you're there.
yep. Any other questions? I will be around if you want. Please take the books. They're great. There's a good sense of humor. And so thank you for the privilege of doing this. If you would like to have you feel free to email me. Anybody can have one free conversation in terms of Medicare, Social Security planning, or just general financial question. I'll be more than happy to chat with you. Just email me and then we'll set a time to do that in terms of that. Thank you, Cami.
Thanks, Mike. Thanks, Mike, for coming today. Again, he's open to answering any questions. If you like today's workshop, it was sponsored by the Pleasant Hill Commission on Aging, and we do have a vacancy if anyone wants to come join us. It's a friendly group. We meet monthly to come up with our programs and such. You can get information on the application online. Or talk to me, talk to Marion, talk to Juanita. Not on my list was to thank Juanita.
Oh.
Didn't provide that. She's our liaison and our support from the city for the Commission on Aging. So our next meeting, our next workshop, you may have seen the flyer around. It's on grief in the holidays. Sign up online or come in. But it is helpful if we know how many people to expect so we can plan the size of our room and such. It's November 13th, 1:30 to 3:30. There is also a QR code for any of our signups now. Juanita set that up. It's been great. The survey, before you go, please fill it out. And if you're online, you have that ability as well. We really do look at them. We really do read them. That's how we knew to repeat all the questions today. So it also allows you to give us ideas for future events and workshops and things. So please fill that out. I promise I'll be reading it. Again, thanks, Mike. And thank you all for coming and for all the great questions. Let's keep the dialogue going together. Thank you.